If you're over 60 and you've been eating these 7 fruits thinking they're keeping you healthy, you need to stop immediately, because what I'm about to reveal is going to shock you. These fruits are recommended by doctors, they're in every senior health magazine, they're supposed to be good for you, and yet for aging digestive systems, these 7 specific fruits are silently destroying your gut, causing inflammation, disrupting your microbiome, and making conditions like diverticulitis, irritable bowel syndrome, and acid reflux exponentially worse. And fruit number 4 is in almost every senior's breakfast routine, recommended for heart health and regularity, but it's one of the worst offenders for gut inflammation in people over 60. In the next 25 minutes, I'm going to explain exactly why these fruits become toxic as you age, what they're doing to your digestive system at the cellular level backed by research from Harvard and the Mayo Clinic, and most importantly, what you should eat instead to actually support healthy aging. I'm Dr. Mizuki Kuroda, and over the past 28 years, I've specialized in age-related digestive disorders. And here's what most doctors won't tell you. Your digestive system at 65 is fundamentally different from your digestive system at 35. Your stomach acid production decreases by up to 40%. Your digestive enzyme output drops significantly. Your gut motility slows down. The bacterial composition of your microbiome shifts dramatically. And the integrity of your intestinal lining becomes more fragile. What this means is that foods you tolerated perfectly in your younger years can become problematic, even inflammatory, as you age. And fruits, despite their healthy reputation, are among the most common culprits. Before we dive into these 7 fruits, you need to understand something critical about aging and digestion. When you're young, your gut is resilient. It can handle almost anything. High fiber, high acid, high sugar, it doesn't matter. Your digestive system powers through it. But as you age, that resilience diminishes. Studies from Johns Hopkins show that by age 60, the mucus layer protecting your intestinal lining is significantly thinner. Your gut bacteria diversity decreases by nearly 30%, and your ability to regulate blood sugar and process fructose becomes impaired. This creates a perfect storm where certain fruits, especially those high in acid, sugar, or insoluble fiber, cause problems they never caused before. Let me also address something important before we start. I'm not saying fruit is bad. I'm not telling you to avoid all fruit. Fruit in moderation, the right types of fruit for your age and digestive condition, can be incredibly beneficial. But the 7 fruits I'm about to reveal are specifically problematic for seniors, especially those dealing with digestive issues. If you're over 60 and you're experiencing bloating, gas, acid reflux, constipation alternating with diarrhea, or unexplained abdominal pain, these fruits might be the hidden cause. Let's get into it. Fruit number 1, grapes. Now, I know this surprises people. Grapes are sweet, they're easy to eat, they're portable, and they're full of antioxidants like resveratrol. But for seniors, grapes present multiple problems. First, the skin. Grape skins are extremely tough and contain high amounts of insoluble fiber. When you're young, your digestive system can break this down. But as you age, especially if you have any degree of diverticulosis, which affects over 50% of people over 60, those grape skins can get lodged in the small pouches of your colon called diverticula. This can trigger inflammation and pain, potentially leading to diverticulitis. Research from the American Journal of Gastroenterology found that tough fruit and vegetable skins are among the most common triggers for diverticulitis flare-ups in older adults. Grape skins, along with corn and popcorn, are frequently cited. The problem isn't just the skin getting stuck. It's that bacteria can accumulate around it, causing localized infection and inflammation. Second problem with grapes, the sugar content. Grapes are exceptionally high in fructose and glucose. 1 cup of grapes contains about 23 grams of sugar. For seniors, especially those with insulin resistance, prediabetes, or type 2 diabetes, which affects nearly half of people over 65, this sugar load is problematic. Your pancreas doesn't respond as efficiently to sugar spikes anymore. Your cells are more resistant to insulin. Eating a large portion of grapes can cause blood sugar to spike dramatically, followed by a crash that leaves you tired, hungry, and craving more sugar. But here's what most people don't know. High fructose intake, even from natural sources like fruit, feeds harmful gut bacteria and yeast. Studies show that excessive fructose promotes the growth of bacteria like C. difficile, and yeast like Candida albicans. These organisms produce toxins and gases that cause bloating, discomfort, and contribute to dysbiosis, an imbalance in your gut microbiome. For seniors whose microbiome diversity is already compromised, eating high-sugar fruits like grapes makes this imbalance worse. Third issue, grapes are often sprayed heavily with pesticides. The Environmental Working Group consistently ranks grapes in the top 5 of their Dirty Dozen list. Pesticides like organophosphates accumulate in your body over time, and they're particularly harmful to aging digestive systems. They disrupt the gut microbiome, damage the intestinal lining, and have been linked to increased inflammation and even neurological issues. If you must eat grapes, organic is essential, but honestly, for seniors with digestive issues, I recommend avoiding them altogether. Alternative: if you want something sweet and easy to snack on, try blueberries. They're much lower in sugar, about 15 grams per cup. They don't have tough skins that cause problems. And they're packed with anthocyanins, powerful antioxidants that specifically reduce gut inflammation. Studies show that blueberries support healthy aging and improve cognitive function. They're one of the best fruits for seniors. Fruit number 2, dried fruits, especially raisins, dried apricots, dried cranberries, and prunes in excess. Now, prunes are interesting because they're recommended for constipation. And yes, they work for that purpose. But excessive consumption of any dried fruit is problematic for seniors. Here's why. When fruit is dried, the water is removed, which concentrates the sugar dramatically. A handful of raisins contains the sugar equivalent of a much larger portion of grapes. You're getting a massive sugar load in a small volume. Dried fruits also contain sulfites as preservatives, especially dried apricots and other light-colored dried fruits. Sulfites can cause digestive distress, headaches, and allergic reactions in sensitive individuals, and sensitivity to sulfites increases with age. Research shows that many seniors who experience unexplained digestive symptoms after eating certain foods are actually reacting to sulfite preservatives. The fiber in dried fruit is highly concentrated and can be harsh on a sensitive digestive system. Yes, fiber is important, but too much insoluble fiber, especially when you're not adequately hydrated, can cause severe constipation and even intestinal blockages in seniors. I've seen cases where elderly patients ended up in the emergency room with impacted bowels because they were eating large amounts of dried fruit thinking it was healthy. Dried fruits also stick to your teeth and promote tooth decay. For seniors who may already have dental issues, compromised enamel, or gum disease, the sticky residue from dried fruits feeds oral bacteria and accelerates decay. This might seem unrelated to gut health, but oral health and gut health are intimately connected. Harmful bacteria from your mouth can travel to your gut and contribute to dysbiosis. Alternative: if you're eating dried fruit for constipation relief, try kiwi fruit instead. Studies from the Asia-Pacific Journal of Clinical Nutrition found that eating 2 kiwis daily significantly improved bowel regularity in older adults without the excessive sugar load of dried fruit. Kiwis contain both soluble and insoluble fiber in better proportions, plus an enzyme called actinidin that aids protein digestion. They're gentle and effective. Fruit number 3, pineapple. I've talked about pineapple before in the context of gastritis, but it's equally problematic for seniors with other digestive issues. Pineapple contains bromelain, a proteolytic enzyme that breaks down proteins. For someone with a robust digestive system, this is helpful. But for seniors with sensitive gut linings, especially those with inflammatory bowel conditions, acid reflux, or peptic ulcers, bromelain can be too aggressive. It can irritate the intestinal lining and worsen inflammation. Pineapple is also highly acidic, with a pH between 3.3 and 5.2. As you age, your body's ability to buffer acids decreases. Your kidneys don't function as efficiently, your buffering systems are less robust. Eating acidic foods like pineapple can contribute to systemic acidity, which promotes inflammation and calcium loss from bones. For seniors at risk of osteoporosis, this is a hidden problem. The fructose content in pineapple is also significant. 1 cup contains about 16 grams of sugar, primarily fructose. As I mentioned earlier, fructose feeds harmful bacteria and can worsen gut dysbiosis. For seniors already dealing with bacterial imbalances, pineapple makes it worse. Alternative: papaya is a much better choice. It contains papain, an enzyme similar to bromelain but gentler. Papaya is less acidic, has a lower glycemic impact, and actually soothes the digestive tract rather than irritating it. Studies show that papaya improves bowel regularity and reduces inflammation in older adults. Fruit number 4, and this is the big one: oranges and all citrus fruits. This shocks people because citrus has been promoted for decades as essential for seniors. High in vitamin C, supports immune function, prevents colds. And yes, vitamin C is important, but the way seniors are getting it through citrus fruits is problematic. Citrus fruits are among the most acidic foods you can eat. Oranges have a pH around 3 to 4. Grapefruits are even more acidic, around pH 3. Lemons and limes are around pH 2 to 2.5. For seniors dealing with acid reflux, GERD, or hiatal hernias, which are extremely common after age 60, citrus fruits are a guaranteed trigger. They relax the lower esophageal sphincter, allowing stomach acid to flow back into the esophagus. They also stimulate additional acid production in the stomach. Research from the Mayo Clinic shows that citrus consumption is one of the top dietary triggers for reflux symptoms in older adults. But the problems go beyond reflux. The high acidity of citrus can erode tooth enamel, especially in seniors who may have reduced saliva production, which normally helps buffer acids in the mouth. Citrus also irritates the gut lining, particularly in people with inflammatory conditions like Crohn's disease or ulcerative colitis, which can develop or worsen with age. Orange juice is especially problematic. It's concentrated acid and sugar with no fiber to slow absorption. Drinking a glass of orange juice causes a rapid blood sugar spike. For seniors with diabetes or insulin resistance, this is terrible. Studies show that regular orange juice consumption is associated with increased diabetes risk and worse glycemic control in older adults. There's also the issue of drug interactions. Grapefruit and grapefruit juice interfere with dozens of common medications, including statins, blood pressure medications, and anti-anxiety drugs. Grapefruit contains compounds called furanocoumarins that inhibit liver enzymes responsible for metabolizing these drugs. This can cause medication levels to spike to dangerous levels. Many seniors are on multiple medications, and adding grapefruit to the mix can have serious consequences. Alternative: for vitamin C, eat bell peppers, especially red bell peppers. They have more vitamin C than oranges without the acidity. Strawberries in moderation are also good. Or supplement with buffered vitamin C like calcium ascorbate. You get all the benefits without the digestive irritation and drug interaction. Fruit number 5. Apples with the skin on. Now, apples are considered one of the healthiest fruits, and in many ways they are. But for seniors, especially, the skin is problematic. Apple skin is extremely tough and contains high amounts of insoluble fiber. For people with diverticulosis, compromised gut motility, or inflammatory bowel conditions, apple skins can cause significant irritation and discomfort. Apple skins are also heavily sprayed with pesticides and waxed to make them shiny. That wax coating traps pesticides against the skin. Even washing doesn't remove all of it. For seniors whose detoxification systems are less efficient, this pesticide exposure adds to the toxic burden and can worsen gut inflammation. The type of fiber in apple skin, cellulose, is difficult to break down, especially if you have low stomach acid or reduced digestive enzyme production, both of which are common in seniors. This can lead to bloating, gas, and that uncomfortable feeling of food sitting in your stomach for hours. Apples are also moderately high in fructose. One medium apple contains about 19 grams of carbohydrates, mostly as fructose and glucose. For seniors with SIBO, small intestinal bacterial overgrowth, which is increasingly common with age, the fructose in apples feeds the bacteria causing the overgrowth, leading to severe bloating and discomfort. Alternative: eat peeled, cooked apples. Applesauce or baked apples are much easier to digest. The cooking process breaks down the cellulose, making the fiber gentler. You still get the pectin, a soluble fiber that's beneficial for gut health, without the harsh, insoluble fiber of the skin. Choose organic to minimize pesticide exposure. Fruit number 6. Cherries. Fresh cherries and especially dried cherries or cherry juice. Cherries are promoted for their anti-inflammatory properties due to compounds called anthocyanins, and yes, they have antioxidant benefits. But for seniors with digestive issues, cherries are problematic. They're extremely high in sugar, about 18 grams per cup of fresh cherries, and much more in dried cherries or juice. Cherries also contain sorbitol, a sugar alcohol that's poorly absorbed in the small intestine. When sorbitol reaches your colon, it's fermented by bacteria, producing gas and causing bloating, cramping, and diarrhea. For seniors with sensitive digestive systems or IBS, even a small amount of cherries can trigger significant symptoms. Cherry juice, particularly tart cherry juice, is marketed for joint pain and sleep, but it's extremely high in sugar and lacks fiber. Drinking cherry juice causes a rapid blood sugar spike followed by a crash, and the sorbitol content is concentrated in juice form, making digestive symptoms even worse. Cherries are also part of the stone fruit family, which includes peaches, plums, and apricots. These fruits contain compounds that can trigger histamine release in sensitive individuals. For seniors dealing with histamine intolerance, which becomes more common with age as DAO enzyme levels decline, cherries can cause a range of symptoms including digestive distress, headaches, and skin issues. Alternative: for anti-inflammatory benefits without the digestive distress, eat blueberries or blackberries. They have similar antioxidant profiles, but much less sugar and no sorbitol. If you want something for joint pain, consider tart cherry extract in supplement form, which provides the beneficial compounds without the sugar load and sorbitol. Fruit number 7, bananas, but specifically overripe bananas. Now, this might confuse people because I often recommend bananas for gastritis and other digestive issues. And yes, slightly green to perfectly ripe bananas are excellent for gut health. They contain resistant starch that feeds beneficial bacteria and helps regulate bowel movements. But overripe bananas, the ones with brown spots all over or completely brown, are different. As bananas ripen, the resistant starch converts to simple sugars. An overripe banana can contain up to 25 grams of sugar, primarily glucose and fructose. For seniors with blood sugar issues, eating overripe bananas causes significant glycemic spikes, and that sugar feeds harmful bacteria and yeast in the gut. Overripe bananas also become very soft and mushy. For seniors with swallowing difficulties or those who've had strokes affecting swallow function, mushy foods can actually be more difficult to swallow safely than foods with some texture. There's a risk of aspiration. Additionally, overripe bananas produce histamine as they continue to decompose. For seniors with histamine intolerance, overripe bananas can trigger symptoms even though fresh bananas are usually well tolerated. Now, I want to be clear. I'm not saying avoid bananas. I'm saying avoid overripe bananas. Eat bananas when they're just ripe, yellow with maybe a tiny bit of green at the stem. At this stage, they have the best balance of resistant starch, moderate sugar, and beneficial compounds. They support gut health without the downsides of overripe versions. Alternative: if you want something easy to digest with similar benefits, try well-cooked white rice or sourdough bread. These provide gentle carbohydrates and are easier on blood sugar than overripe fruit. Now let me give you the bigger picture of why these 7 fruits are particularly problematic for seniors. It comes down to 4 main factors: sugar content, acidity, fiber type, and pesticide load. As you age, your ability to handle each of these factors diminishes. Your pancreas doesn't regulate blood sugar as well. Your body can't buffer acids as effectively. Your gut motility slows, making harsh fibers problematic. And your detoxification systems are less efficient, making pesticide exposure more harmful. This doesn't mean you should avoid all fruit. Fruit provides important vitamins, minerals, antioxidants, and fiber. But you need to be selective. Choose fruits that are lower in sugar, less acidic, easier to digest, and lower in pesticide residues. Focus on berries, melons, papaya, peeled cooked apples, kiwi, and perfectly ripe bananas. These fruits provide nutrition without the digestive distress. Here's what I want you to do. If you're over 60 and you've been eating any of these 7 fruits regularly, eliminate them for 30 days. Replace them with the alternatives I've suggested. Track your digestive symptoms daily. Rate your bloating, gas, reflux, bowel regularity, and overall abdominal comfort on a scale of 1 to 10. After 30 days, compare your symptoms to where you started. I'm confident you'll see significant improvement. I had a patient, Margaret, age 68, who came to me with severe bloating, alternating constipation and diarrhea, and constant abdominal pain. She'd been through every test, seen multiple specialists, tried elimination diets. Nothing worked. When I reviewed her diet carefully, she was eating grapes daily, drinking orange juice every morning, and having dried apricots as snacks. She thought she was being healthy. These were the fruits recommended for seniors. We eliminated all 7 of these fruits immediately. We replaced them with blueberries, melon, papaya, and peeled cooked apples. Within 2 weeks, her bloating decreased by 50%. Within a month, her bowel movements normalized. By 3 months, she was essentially symptom-free. Was it just the fruit? No, we made other changes too. But removing these problematic fruits was the critical first step that allowed everything else to work. Now I need to hear from you. Drop a comment right now and tell me, are you over 60? Which of these 7 fruits do you eat regularly? Have you noticed digestive symptoms after eating them? Your input helps us create better content for the senior community. We read every comment, so share your experience. You might help someone else who's struggling with the same issues. If you want comprehensive information on senior digestive health, including meal plans, supplement recommendations, and lifestyle strategies for healthy aging, make sure you're subscribed. We're creating content specifically for the unique needs of older adults. This channel is becoming a trusted resource for seniors who want real solutions, not just band-aid approaches. And if this video opened your eyes to why you've been having digestive problems despite eating healthy, smash that like button. Share this with other seniors in your life. There are millions of older adults suffering with digestive issues right now, eating these fruits thinking they're doing something good, not realizing these foods are making their problems worse. By sharing this information, you're helping improve quality of life for others. Let me address some questions I anticipate. People will ask, what about frozen fruit? Is that better? Frozen fruit is often picked at peak ripeness and flash frozen, which preserves nutrients. But the same issues apply. If it's a problematic fruit like grapes or cherries, freezing doesn't change the sugar content, the fiber type, or the other compounds that cause issues. However, frozen blueberries or strawberries are excellent choices and often more affordable than fresh. What about organic versions of these fruits? Organic eliminates the pesticide concern, which is important, but it doesn't change the sugar content, acidity, or fiber type. Organic grapes still have tough skins. Organic oranges are still highly acidic. Organic is always better when possible, but it doesn't make a problematic fruit appropriate for your digestive condition. What about fruit smoothies? Smoothies can be tricky. On one hand, blending breaks down the fiber, making it easier to digest. On the other hand, smoothies often contain multiple fruits, concentrating the sugar load. And drinking your calories bypasses the satiety signals that come from chewing. For seniors with blood sugar issues, fruit smoothies can cause significant spikes. If you make smoothies, use mostly vegetables with just a small amount of low-sugar fruit like berries, and always add protein and healthy fat to slow sugar absorption. Can I ever eat these fruits again? That depends on your individual situation. If you have active digestive disease like diverticulitis, Crohn's, or severe reflux, these fruits might need to be permanently avoided or only consumed very occasionally in small amounts. If your issues are milder, once your gut heals and your symptoms resolve, you might be able to tolerate small amounts of some of these fruits occasionally. The key is healing first, then testing carefully one at a time. What about supplements? Can I get the benefits without eating the fruit? In many cases, yes. If you want the antioxidants from grapes, take resveratrol supplements. If you want the vitamin C from oranges, take buffered vitamin C. If you want the digestive enzymes from pineapple, take bromelain capsules on an empty stomach so they don't irritate your gut. Supplements can provide targeted benefits without the downsides of whole fruits in problematic cases. Here's a principle for senior nutrition that I want you to remember. Gentle, easy to digest, nutrient-dense, low glycemic. Those are your 4 criteria for every food you eat. Ask yourself, is this food gentle on my digestive system? Is it easy for my aging body to break down and absorb? Does it provide significant nutrition? And does it keep my blood sugar stable? If the answer to all 4 is yes, it's a good food for you. If the answer to any of them is no, reconsider whether it belongs in your diet. Aging doesn't mean you have to accept digestive problems as normal. Yes, your digestive system changes, but with the right food choices, you can maintain excellent gut health well into your 80s and 90s. I've seen it happen countless times. Seniors who make strategic dietary changes experience dramatic improvements in digestion, energy, mental clarity, and overall quality of life. These 7 fruits are just one piece of the puzzle. There are other foods that become problematic with age: raw cruciferous vegetables, beans and legumes in large amounts, high-fat dairy, spicy foods, processed foods with additives. We'll cover those in future videos. But these 7 fruits are a great starting point because they're so commonly consumed and so frequently the hidden cause of unexplained digestive symptoms in seniors. Your action plan is simple. Today, right now, remove these 7 fruits from your diet. Stock up on the alternatives I mentioned. For the next 30 days, stick with gut-friendly fruits and track your symptoms. Give your digestive system a chance to calm down and heal. After 30 days, assess where you are. I'm confident you'll feel dramatically better. Remember, you're not trying to live forever. You're trying to live well for as long as you're here. Quality of life matters more than longevity. And quality of life is impossible when you're dealing with constant digestive distress. By making these simple changes, by eliminating these 7 problematic fruits and replacing them with better options, you're taking control of your gut health and reclaiming your comfort and vitality. Your gut is the foundation of your overall health. When your gut is inflamed and dysfunctional, everything else suffers. Your immune system weakens, your brain function declines, your energy plummets, your mood deteriorates. But when your gut is healthy, when digestion is smooth and comfortable, everything else improves. You feel better, you think clearer, you have more energy, you sleep better. It all starts with what you put in your mouth. You now have the knowledge. You know which fruits to avoid and why. You know what to eat instead. You have a clear action plan. The only question is whether you'll implement it. I can give you all the information in the world, but I can't make you take action. That's up to you. But I believe you will, because you're here, watching this video, seeking answers. That tells me you're motivated to improve your health. Start today. Not tomorrow, not next week, today. Remove these 7 fruits. Replace them with better options. track your progress, and come back in 30 days and leave a comment telling me how much better you feel. I want to hear your success story. And I want other seniors to see that this works, that simple dietary changes can have profound effects. You deserve to feel good. You deserve to eat without fear and discomfort. You deserve to enjoy your senior years with vitality and health. These 7 fruits have been holding you back. Now you know. Now you can make different choices. Now you can heal. Your gut is waiting for you to stop irritating it and start nourishing it properly. Make that choice today. I'll see you in the next video where we'll dive deeper into senior gut health. Until then, take care of your digestive system. It's been working hard for you for decades. Give it the support it needs. See you soon.